Lastly, we'll speak about the joints of the hand. So in a previous model, when we look at the appendicular skeleton, we talked about the carpals, the metacarpals, the phalanges. And so we can speak about the joints that help to articulate these various bones. First off are the metacarpophalangeal joints, sometimes called the MCP joints. And they articulate the metacarpals, which is this layer here, not to be confused with the carpals, which are these. So the metacarpals and the proximal row of phalanges are articulated via the MCP joint. The first row of phalanges and the second row of phalanges articulate by the PIP joint, the proximal interphalangeal joint. And then the second row and the third row are articulated via the distal interphalangeal joints, okay? Now remember, we don't have a middle phalange on our thumb, so we only have a distal phalange. We've got an MCP and a DIP, metacarpophalangeal, and a distal phalangeal joint. Lastly, two important groups of muscles in the hand. First, the hypothenar muscles. So these are the muscles on the medial surface of the hand. We won't speak about the individual muscles that form this surface or this eminence, as it's called. But we will just speak about the medial side being called the hypothenar eminence collectively, and the lateral side, the surface closest to the thumb, being called the thenar eminence or the thenar muscles collectively, right? So hypothenar on the medial side here, and then thenar collectively on the lateral side. Okay, let's get into some of the neurovascular structures here. So we'll start with the brachial plexus. Now the brachial plexus is a network of nerves that comes from the cervical region of the spinal cord, travels through the neck and through the axilla, and eventually branch into the nerves, the terminal branches that supply the muscles, all of the muscles we just talked about that move the upper limb. So we've got roots coming from those spinal cords, we've got trunks, divisions, cords. We're not interested in this proximal part of the brachial plexus. All that you have to know for this unit is pretty much the terminal branches. So there are 5 terminal branches of the brachial plexus that we are concerned with. The first one is called the musculocutaneous nerve. This is on the lateral side. The second is the axillary nerve. Then we've got the median nerve, which traverses the center of the brachial plexus here. And then on the medial side, we've got the ulnar nerve, right? And then posterior, coming off the posterior card, we've got the radial nerve and the axillary nerve. Now the radial and axial nerve come from the posterior cord of the brachial plexus and supply muscles such as the deltoid muscle of the shoulder that we spoke about earlier, and the triceps muscle of the posterior arm that we also spoke about earlier, and they're coming off the posterior cord of the brachial plexus. So let's look at where those distal or terminal branches actually travel, okay, in terms of their interaction with the anatomy of the upper limb. So here on the medial side, we've got the ulnar nerve going posterior to the medial surface of the humerus here. We've got the axillary nerve going around the shoulder. This innervates the deltoid muscle. We've got the median nerve going right down the center here, right through the middle of the forearm. This innervates most of the muscles in the forearm. We've got the musculocutaneous nerve on the lateral aspect of the arm. Musculocutaneous innervates all the muscles of the anterior arm. And then lastly, we've got radial. Radial goes to the back of the arm and innervates the triceps and all of the posterior forearm muscles, okay? The arteries that supply blood to the forearm all branch from the subclavian artery. So the subclavian artery is so called because of its interaction, its relationship with the clavicle. So it goes underneath the clavicle, hence the term subclavian. And after doing so, the same vessel actually changes its name. So it becomes the axillary artery as it goes through the axilla or the axillary region. So the armpit is typically called the axilla. And then when it runs alongside the arm or the humerus, it becomes the brachial artery. Brachii meaning arm or of the arm. So the same vessel just changes its name as it travels from the core out to supply the limb itself. So subclavian artery up to the clavicle, then we've got axillary artery up to the interaction with the humerus, then we've got the brachial artery the rest of the way. When it gets to the elbow, it divides into two main arteries, the radial branch, which goes to the lateral aspect of the forearm and hand, and then the ulnar branch, which does the medial aspect of the forearm and hand.